This is Boomer Life on CL 650.
Welcome back to the program. Dr. Amin Javer is with us from FalseCreek Healthcare Center, where he is an otolaryngologist specializing in sinus issues and surgeries and procedure. But, Doctor, you talked a little bit about, we talked about mouth breathing and people who have sinus issues and who can't breathe through their noses for medical reasons. And that, you've talked a little bit about snoring. I asked you, I bet you these people snore a whole lot. And you said they sure do. So is snoring a symptom? If you live with someone who's a chronic snorer, and I know someone, married couple, been married for probably 30 years, they sleep in separate rooms because she can't handle his snoring, and that's the end of that story, and that's why they're still together 30 years later. But so it's pretty serious with some people and pretty loud, too. So is that sinus related then?
Yeah, so snoring is a big issue. Snoring is a very big issue. So when you talk about snoring, you need to start thinking about something called sleep apnea.
Okay.
Yeah, that's a really important word. So you can have just simple snoring where the patient makes a loud noise and bothers everybody in the house. Or you can have somebody who snores and then stops breathing. And that becomes really serious then. So snoring happens because people can't breathe through their nose. They start opening their mouth and breathing through their mouth. Right. And then the flap in the back, the uvula, and if they have a large tongue base which flops back, the uvula and the tongue base hit each other and create this snoring sound.
That's the sound?
That's the sound.
Okay, interesting.
So as long as you're making the sound but still breathing, you're going to be okay because you're going to still be able to sleep. But the minute you plug up, you're going to wake yourself up. Right. And sometimes it's called a microsleep, where you're just waking yourself up just enough to start breathing again, but you're not completely aware that you've woken yourself up. So when you wake up in the morning, you're just fatigued. You're so tired because you've had all these microsleeps and all these apneic episodes. And these patients are in real trouble because they're not sleeping. They're chronically tired. Their heart gets stressed out. Right. Their blood pressure goes up. And they can get early heart attacks, and they can get very sick. So you send them to a sleep lab, right? And they get tested at a sleep lab where they get connected to machines, EEGs and stuff. And you can tell how many times a night they're stopping to breathe. And if they've got sleep apnea, then they're in real trouble. Snorers, you can fix them quite easily because you can actually remove that excess tissue from the back of their throat. It's a fairly simple procedure. It's a simple procedure. It's done with the patient either awake or asleep. They can choose. And then they're fine. They'll stop snoring.
But for people with sleep apnea, I know one possibility is this CPAP machine, this breathing machine. It's a mask, kind of like a surgical mask. Correct. And they wear that. My brother wears a CPAP machine. He has sleep apnea. Correct. And every night he puts on the mask. Well, now he's got a nose tube because it's more comfortable. Right. But he can't go through a night without his CPAP machine.
And so that's extremely important for someone like him because if he didn't have that, it would really affect him in every part of his life. Right. But the fact that he's got something to push the air through when his brain won't do it, it's really helpful. You can have something called central apnea because their brain will just stop breathing. Or you can have peripheral apnea, which is what we're talking about, where you've got obstruction. So if you have an obstruction, I can fix that. Okay. I can fix your upper airway so you can breathe perfectly. Easy. Right. But if you've got central apnea, then you can't really fix that. So that's
a brain thing.
It's a brain. Your brain turns off. Right. So it doesn't want to keep breathing all the time.
So then that machine is critical.
It's critical. So it pushes the air in when the brain stops. So that's really, really, really important. So for someone like him, it can be such a big factor in having a great life.
And I was just going to say, would that eliminate those little waking episodes because your body wakes itself up to breathe when your brain when it forgets. Correct. So if you've got the machine doing that for you, are you going to sleep better?
Very much so. You can get actually a perfectly good night's sleep and wake up feeling very refreshed and very healthy. Okay. So that's a really important topic to discuss. Yeah.
All right. I wanted to ask you about tonsils, and I have this as an example. When I was a little guy, I had my tonsils out, as most of us did. Tonsils and adenoids, except I had mine out twice because whoever the first guy was got the adenoids, I guess, but kind of blew the tonsils, and I had to go back and have them done a second time. How weird is that?
Yeah, so tonsils, when you take out tonsils, you need to take the whole tonsil out, because if you leave a portion of it behind, it can certainly regrow
apparently
and get
does,
reinfected.
Yes.
And in the olden days, quite often they just chopped off the top of the tonsil. They left the bottom part inside, and it just regrew.
So that would be what happened to my case.
Correct.
Okay.
And adenoids, in the past, a lot of the adenoids were being done fairly blindly. So you would put a little mirror in the back of the throat and just scrape the adenoids out.
Right.
And so we don't do that anymore. We actually use scopes, the same silver scopes that you're talking about.
Little TV cameras.
Yeah, TV cameras, and we do it under direct vision, again, off a screen. So we can take the adenoids out perfectly and make sure that we get it all out, and take the tonsils out completely, so you don't have any of it left behind. And that's really important. So not everybody gets their tonsils and adenoids out anymore.
I was going to ask, that was my next question, in fact. You know, we're grandparents and aunts and uncles and moms and dads here, and I'm curious about that. Is in 2015, is it sort of obligatory or pro forma that most little kids get their tonsils out automatically now?
No, not at all. It's
really?
Actually the other way. It's actually the opposite, because most of us, the tonsils will just disappear on their own by the time you're teenagers. They just shrivel away. And same thing happens to the adenoids. So there's criteria. So in the pediatric guidelines, there's criteria on how many infections you need to have per year before you should consider getting the tonsils out.
I see. Okay,
yes,
because there's a certain threshold
exactly.
of tolerance for some infections.
Correct. So if you get more than 3 infections a year, then it's recommended that you take them out, because they're causing you too much trouble.
Right.
In children, because adenoids hang on to a lot of bacteria, it sometimes will take the adenoids out because they're getting recurrent infections in their sinuses and in their ears, because the bacteria come from their adenoids and infect the ears and the sinuses. So taking the adenoids out takes away the infected pool, and then the sinuses and ears will clear up.
Oh, okay.
So that's important. We're seeing a lot of elderly, when I say elderly, older people in their 20s, 30s, and even 40s, who didn't get their tonsils out when they were young.
Right.
And now it's causing them trouble. One of the biggest things that I find women coming in for is bad breath. So they'll say, oh, I have this horrible breath because I get these tonsil stones in my tonsils, and I hate it, and I want this gone. And the only way to get rid of it is by actually removing the tonsils.
And so is the procedure the same thing they did on me when I was a little kid?
Well,
exactly the same thing?
I think a bit more sleeker.
Well, I was just going to say, chances are it's evolved, happily in a good way.
In a good way.
So it's still, there are still grown-ups,
yes,
lots of them with tonsils, and most of them not affected.
Correct.
But in some cases, it can go sour on you.
Correct, yeah. So sometimes, once in a while, we'll do tonsils in like a 35-year-old nurse or something who just hates the bad breath in from her mouth.
Oh, right.
So that's a nice way to deal with it. Yeah.
The old halitosis horror show. Huh?
Yes, that's right.
Well, that's really interesting.
Yeah.
Dr. Javert, we're fresh out of time, sir, and I regret that only because you're such a treat to talk to. And here we are in the heart of allergy season, and you've just held my hand and walked us through all sorts of issues relating to allergies, our sinuses, our noses, and the good news is, of course, you're available all the time at FalseCreek Healthcare Center. And by the way, if you want to check out Dr. Javert, the FalseCreek Healthcare Center and his colleagues, and the multiplicity of services provided, check out the website. It's FalseCreekHealthcare.com. And Dr. Javert, a pleasure to meet you. Thank you so much for joining us today on Boomer Life.
My pleasure.
See you next time, right here on CIL 650.